Hey guys, this is Dr. Mahajan, and we are very excited. We got a new edition for you from Mahajan Medical Center. I'm an internist. I specialize in family practice, and we are in Largo for the last 25 years. We do a weekly broadcast on every Thursday, and we are very excited. It's going to be on Instagram as well. We're going to be talking today about mental health issues, which has been come to more prominence with COVID-19. And Kelly Smith started a watch party for us, and very excited. Thank you, Kelly. Let's see. Rashmi is there. Thank you, Rashmi. She's a good, solid supporter of our podcast, and we love Rashmi for being there at our face party. And then Mark is here. Thank you, Mark. Mark is also always watching us on the program. So we appreciate, Mark, for your support. So let's get started. So why COVID-19 is a special situation for mental health? One of the main reasons for COVID-19 to affect us all is because we are going through social isolation at home, and that's creating a lot of anxiety because we have fear of unknown, when the pandemic going to end, when we're going to have a vaccine. So people have a lot of anxiety because of that. Now, what can we do about it? So that's an important question. We established that it's causing anxiety because of social isolation. A lot of healthcare workers on front line are dealing with a lot of post-traumatic stress. Physicians, nurses. There was a ED physician in New York who committed suicide, unfortunately, and she was overwhelmed with the COVID-19 care. So what can we do to prevent that? What can we do to pick it up early so that we, don't get to that point? So that's what we're going to be talking today in our podcast, and we're going to give you some tips for that. All right. So, the other people who are dealing with additional stress is people with comorbid conditions. So let's say you're 65 plus and diabetic, obese, COPD, CHF, on cancer treatment or heart failure, any of multiple host of things. You're worried that you're going to catch that, and that's a serious concern. The people who are in grocery stores, the employees dealing with a lot of public dealing, they are anxious too that they will get it from the customers. So that's always a challenge, and people are living alone in their bubble and have less opportunity of interacting with other people, and that also increases the anxiety. And how does it manifest? It can manifest in disturbance in sleep. It can manifest in mood disturbance, that you are more moody, and your eating pattern can change. You can eat more comfort foods, more foods which you normally don't eat as much, and now you're eating more, junk food, snacks. Or you may eat less, and you need to start recognizing that's a sign of anxiety. That's a sign that you coping abnormally with the mood disorder. You can have difficulty focusing and concentrating at your work, at home, in finishing your tasks. So that could be, again, a sign of anxiety and mood disorder related to COVID-19. You can have worsening of existing mental health issues. So let's say if you have bipolar mood disorder, chronic anxiety, depression, that may get worse as well. So it's important to keep in mind that these are the symptoms you should be looking out for. Or God forbid, if you already have serious depression, then your mental health issues may get worse, and you may get, in extreme cases, suicide ideation, or you start using substance abuse like alcohol or OTC drugs or narcotics. So you need to watch out to make sure you're not heading in that direction. Again, this podcast which we are giving today is just a general tips. It does not replace any medical advice. Just a disclaimer. If you are our patients, we'll be more than happy to see you if you're having these symptoms. If you're not our patients, then definitely call your internist or family practice doc or your psychologist or psychiatrist to deal with these symptoms. And if earlier you do it, then you can get some counseling or treatment or therapies or medications if needed to prevent you to get to the extreme cases. So that's very important to acknowledge that you have it. And there's no stigma. This is a very difficult time. So the first step is acknowledging, and then second step is seeking professional help. So again, the podcast we're doing is general tips, as does not replace a professional one-to-one advice. So what can we do? So let's talk about that. So the first step we can do is establish a routine or new normal. So what I mean by that? If you can start thinking about keeping yourself busy, making sure you sleep 8 hours a day, make sure you have a structure, write it down on a whiteboard, your routine. So, so that way, earlier you are going to work, let's say you work, and now you're working from home, keep that 9 to 5 set up for work. And then, make sure you take breaks in between for lunch, like you will do at work, and you chat with your colleagues in your 9 to 5, make sure you Skype or WhatsApp your colleague or whatever method, Zoom or team meetings you have to, keep that routine going. Make sure you eat well too. That's part of your new normal routine. Eating has a profound effect on how you feel. If you eat well, let's say a lot of fruits and vegetables, a lot of whole grains, Mediterranean diet, it will have profound effect on your microbiome, on your skin, inside your gut. And that changes how you think as well. So there is a huge data about how you eat affects your thinking. And, if you eat more junk food, it causes more changes in your microbiome and causes more stress. If you eat more whole grains, beans, things like that, brown rice, quinoa, fruits and vegetables, diet rich in fish, you will see that you'll be thinking more positive as well. So, that's new normal. So you need to have a good structure in your nutrition. Sleep is very important. No matter how much immune boosting medications or supplements you take, like vitamin C or any other medications, but you will see that it won't help you if you don't get good sleep. So sleeping 8 hours or whatever your normal is critical as part of your, establishing a routine or new normal. So that is critical. What's the next step? Engaging in regular vigorous exercise. It sounds very simple, and it is simple, but if you do it regularly, you will see that, you will be more energetic, you'll be more positive in your thinking. And it could be just a Zumba, it could be a Pilates, could be an online and Mahajan Medical Center. If you go to your YouTube channel, do subscribe. And this is going live on YouTube channel as well. So if you have friends who go to YouTube channel, do mention to share and subscribe and like our YouTube. And also, if you can hear me well, please give me a thumbs up today. And if you find our information useful, give us some love on Facebook. If you're on Facebook or if you're on Periscope, give us love there. And if you're on YouTube, give us likes. So please give us likes. So that adds as a fuel for me to keep researching and bringing you topics which could be useful to you. So do give us love today and right now, and give me some wows so I can keep adding some fuel. Thank you for giving all those likes. I appreciate that. So will continue. I was thinking of shutting down because you didn't give me enough likes. All right. So what's the next step? Engage in regular vigorous exercise. So the goal is to get 30 minutes of brisk walking and get your heart rate up. Could be brisk walking, as I said, could be Zumba, could be Pilates, anything, just biking, whatever makes you stick to a routine. Could be playing with your kids, could be going out in the park and hitting a soccer ball, could be playing tennis, anything, 30 minutes. And, the good thing is the outdoor, you don't get as much transmission of the coronavirus. So, that is important to bear in mind, that outdoor is safe in terms of, and that leads to our next point, which is going outdoors. The outdoors, a lot of studies have shown if you camp for 1 week, you can reset your clock without the distractions of, texting and social media. It will help you sleep better. If you're a camper, go out camping. If you have access to a beach, go out to a beach. In Florida, we're blessed with beautiful beaches. So use those. I think we use them when the guests come to our town. We should use it ourselves to watch sunset, go out. Fantastic effect on our immune system. So that's important. What's the next thing we can do? We talked about vigorous exercise. We talked about new normal routine. Let's go to the next step. Find ways to reach out. So what I mean by that? So, right now we are in a tight bubble. You can text your loved one, hey, I love you, just a couple of times a day. You can go on Skype with your mom and dad. Maybe your neighbor is, elderly and they need some help with grocery. Maybe reach out to them, and say hello to them, knock on their door, keep the 6 feet distance, use your mask, but say, hey, do you need anything? We're all in this together as a community. So if you reach out to your fellow human beings and, your family and friends in different ways, WhatsApp, make a group and chat regularly. You can make a Zoom meeting. I do that every Saturday with my siblings, and I do with my parents. So anything which you were doing before, you should continue doing and do more, and use the technology. Zoom is fantastic. Team, if you're at office, Teams are good, but WhatsApp, you can do video chat on WhatsApp. People who have family outside United States, they are very familiar with WhatsApp. Is free, and you can do a group chat. So reaching out, or you can write an old-fashioned letter. I think it's very therapeutic and very lovely to get a letter from your loved one. So that's what I'll definitely recommend. Let's see who is joining us. Ray Davis, our famous, organizer. He does a great job with all the retired people from Ford and, Detroit or Michigan folks who UAW. And Ray does a good job in organizing them, providing them benefits. So thank you, Ray, for keep doing what you're doing for your community. We got Beverly there. She is always enjoys our talks. Thank you, Beverly, for your kind words. We got Desiree there, and she's saying thank you for my talk. And Janice, our old friend, she moved away, and we always miss Janice. She is a fantastic supporter of our practice. So thank you, Janice, for tuning in. All right, so let's go back to finding ways to reach out. We talked about that. So let's go to the next topic, which can help you relax. And so we're covering host of different techniques to cope with the mental health epidemic. And trust me, what I research, it's not looking good in terms of what's coming. There's a tsunami of mental health issues coming with the post-traumatic stress in healthcare workers and people who are isolating themselves. And, still there's no end to sight. The vaccine is a year away, God willing, and hopefully it's effective. So, we hardly 5% prevalence in Pinellas County. By the way, I just read data today in Pinellas County. So the good news, the ICU admissions are less for COVID-19 in Pinellas County. The bad news, there's still a lot of new cases in the younger population. So I went to the farmer's market, and I saw a lot of folks without the mask. I went to Publix and I saw a lot of folks without the mask. I think that's a serious no-no. The young folks get it. Fortunately, with COVID-19, as you know, they're not going to get the death or morbidity or end up in ICU. Is the older folks, when they go home and with their parents, with their grandparents, when they interact and they could be asymptomatic. And WHO, walked back on their words about asymptomatic, which I didn't agree when they said asymptomatic people does not spread the COVID-19. The CDC was very emphatic. Yes, the asymptomatic patient do spread the COVID-19. So the younger folks, they're going to be asymptomatic. They are the one, who will do okay. But, how are they going to live with the guilt of their parents or the grandparent getting it and they ending up in ICU? So for the younger folks who are listening, please wear a mask, not for yourself, but for your grandparents and your parents' sake. So please don't let your guard down. The new cases are still happening in Pinellas County. So let's keep doing what we were doing earlier. It's not changed just because the phase 1 or phase 2 is happening. We got to be on our lookout. So coming back to the tricks, we're teaching you how to cope with mental health issues. So we talked about, let's just do a quick recap. We talked about establishing a new routine, which includes, eating better, sleeping better. And then we talked about regular exercise, get your heart rate up for at least 30 minutes, high intensity interval training. If you want to, you can go to a Mahajan Medical Center YouTube channel. We put some beautiful videos with our nurse practitioner, Jordan. She's a good trainer, and we're going to, in fact, get her on our show next time, and she's going to give you some exercise tips as well. So tune in for that with the next show. And then we talked about find ways to reaching out with Zoom, with FaceTime, with WhatsApp or any other technology, or texting or writing your old style lovely handwritten letters. So let's talk about the next thing. Connect with those who are self-isolating. We touched on that. Knock on your neighbors if they need help with grocery, or just say hello and they are missing the human contact. So it's important that we do that on a regular basis. Let's see, the next piece up is manage your news consumption. I think that's important, that we're getting so much thrown at us for last few months in terms of the data. In terms of data, I just wanted to check that you can hear me well. Give me some love, give me some thumbs up, give me some likes if you can hear me well, and our sound quality is good, so I know that it's happening. Oh, okay, thank you for letting me know. Give me some hearts, give me some wows, and please share our podcast with your friends and family, and do a watch party if you can. All right, so the next step we were talking about is manage your news consumption. So we've been thrown news through a lot of media, and some of it is repetition, and some of it is fake news. So I think, the amount of consumption you need to reduce, not more than 20-25 minutes a day. Maybe a site like CDC or Pinellas County Health Department, CDC is good, or any other newspaper source. Go there, consume it, and then don't go back looking at different feeds coming on your Facebook or any other way you consume your news, because that makes you more anxious. That's a lot of anxiety which comes with, as if it's happening in your backyard, and, you don't want that. You want it to be based on what you want to consume, not everyone forcing it on you. So that's, I think, is the important point, that consume less of the news media. All right, so what's the next tip we can provide you? So the next tip is engage in a hobby or find something absorbing to do. I think that's obvious. If you can do something like gardening or something new which you've been wanting to do and you didn't have time, now you're in a bubble and you have more time. Learn a language. There are a lot of free apps to learn a language, learn musical instrument like piano or anything. Give me a comment if you are suffering from any anxiety or any issues with COVID-19. Let me do a polling of the people who are listening, that how many of you are having issues. Put in the comment section, and then I'll see how many of my listeners are going through what I've seen in my patient population going through. So yes, hobbies and activities which keeps you absorbed and get you more skills. If you are working from home and you need certification in Microsoft, or any other certification, a lot of universities have moved to online and they can provide you certification. So that's a great time to enhance your skills. So do that. So the next piece up is practice mindfulness. How many of you know mindfulness and practices? Put in the comment section. I want to see, how you do it. So the mindfulness is one of my favorite subject. So the key is, it's not something difficult. It could be hard, but it's not something difficult. So what's the key concept of being mindful? The key concept of mindful is that you don't worry about tomorrow. You have no control. You live in the present. So that's mindfulness. So if you have anxiety, register it. It's okay to be anxious. It's good to be sometimes anxious when you have exams coming or you have deadlines. That helps you, meet those. So, but when it gets overwhelming, that's where when you live in the present, you don't worry about whether you're going to get COVID-19 tomorrow or your mom will get COVID-19 or your dad or grandmother. You have no control on that. What you have control on is that you wear your mask. When you go out, you wash your hands, you keep your 6 feet social distancing, and you're living in the present by doing that. So it is being mindful when you're doing common sense things for what you can do for today. And it will help you reduce your anxiety if you're mindful of what's going on. The other strategy for being mindful is what I teach you in every podcast and will teach you today as well, is breathing and meditation. It helps you stay in the present. It helps you center you. The breathing, the pranayama, the exercises which I teach you. If you can do 10, 15 minutes twice a day, I taught you 4 of them, and I'll bring a new one called KapalaBhati to you today. They have been shown in different studies with functional MRIs of the brain, and that it helps you reduce your anxiety, it helps you clear up your brain, and it doesn't have any side effects. It's not like Xanax that once you get on that, you can't come off. It's a good thing to do those mindful strategies. Other trick for helping you with the anxiety is write it down. So let's say you're having a lot of anxiety that your dad is sick and it has COPD, he's a smoker. Is he going to get COVID-19? Write it down. That's what you're worried about. Once you write things down, then it comes to your conscious mind. And then you say, okay, what can I do today to help my dad? So just call him, just say, hey, Dad, I love you. My earlier strategy of staying connected. So using that strategy now, so that will calm you down that you did something about it, and say, hey, Dad, if you need grocery, let me do it for you. You don't go out. So that's the second strategy of helping your neighbors, helping your loved ones, helping your family. So now suddenly you're living in the present. You wrote down the anxiety, you wrote down what was bothering you, what was eating you up, and you did something useful for that. That's being mindful. So it's not a difficult strategy once you know what it means. And by writing your emotions, I think it's a great tool, to help you understand where you're coming from. It's good to be anxious, good to, have some anxiety. As I said, it helps us motivate, helps us understand that we got to be careful. So it's a human nature that those emotions keeps us safe. So, and then, use common sense strategy. Don't go overboard in terms of, taking precautions. You got to go outdoors. Just remember, outdoor transmission of COVID-19 is not as bad as indoor transmission. So going to movie theater, going to church, if you're a senior, I won't recommend, but going to park, going to beach, taking a walk around your block, I'll highly recommend. Put a mask on and just go out and walk and bike or whatever you want to do. Even if someone has COVID-19 passes you, you're not going to get it. There's a lot of air which dilutes the droplets outside. So again, all those things ties together, as I just alluded to you earlier. The other piece is be gentle to yourself and others. And I mentioned that in my ending of my podcast every time. And there's a reason for that. So everyone is stressed right now, whether they lost a job or they're working from home, they got a 10% pay cut. Reduce your expectation in a relationship. Don't expect your wife, your husband, your son, your daughter to be perfect at this time. Just reduce your expectations. Same thing with your colleagues. Productivity will be down. We had a virtual school with my kids, and it was hard. The teachers didn't know what to do. The kids didn't know. The parents didn't know. And the parents, the teachers were pushing a lot of homework as if they're in the school, but they were not getting the concepts. And they should have reduced the expectation at that time. But, that's a new stuff for everyone. So that's where this strategy fits in. Be kind and gentle to yourself, your colleague, your kids, So let's change topics and talk about what are the other tools. There is a online therapy, if you need therapy, called Talkspace. And I heard, decent things about them. I don't know what the pricing is, but, it gives you another tool if you need someone professional to talk to, if, all the other tips I've given you doesn't work. Now, the other piece you can do, which is my favorite piece, is apps. If you're tech savvy or you have already iPad, iPhone, or Android devices, you can download COVID Coach. COVID Coach is a beautiful app or a good app where it gives you different resources of how to cope with COVID-related anxiety. It's free. COVID Coach app is free. So download that, see if it works for you. And then the Headspace is another of my favorite app. I have it for myself too on my iPad and my iPhone. It's free for healthcare workers. I'm not sure that promotion is still on, but that's something, if you are a healthcare worker, and I know a lot of my listeners are nurses and physicians, it's free. The Headspace is free. I think the trial is still on, so download that. If you're not a healthcare worker, I think they have a lot of free trial and a lot of free stuff, but then you have to pay monthly for anything good. But they have a lot of great tools on meditating, on relaxing, on sleeping without medications. And I've tried it myself, and they've done a good job for a app. So look at that app, see if that fits with your lifestyle. Last not the least, nothing to scare you, but I think it's good to have this handy for you or your loved one. If you think they're depressed and they are end of the rope, make sure this number is handy for them. And that's a hotline, and they will walk you through if you are feeling suicidal or depressed. There is another texting app or texting you can do at 741-741. So the number is, again, 741-741. That's a texting app, not an app, but texting. So you can discuss, if you're feeling depressed or gloomy, what can you do in terms of, to get you through that gloominess. So that's another way of doing it. So that covers a whole lot of different ideas which may help you. And some may work for someone, some may not work for other person. But again, as I said earlier, this does not replace a professional advice. If you're really having a lot of mental health issues, and we talked about the symptoms, you're having difficulty focusing, you're having change in your habits in terms of drinking too much or consuming too much cannabis or or street drugs, that's red flags right there. Then you definitely need to get professional help. So my talk does not replace the professional help you need to seek. Let's see who's tuned in. We got a few questions. Let's bring this question about, all right. So we got a comment from Miss Fink. She said, keep up the pep talk. Yes, Miss Fink. Miss Fink is a herself very capable retired administrator in a nursing home, and she knows how the frontline people feel the pain of dealing with the sicker patients on day-to-day basis. Let's see, Mark has a question. Let's see. Okay, so Mark has a question, and I think that's a good question. Mark is saying, I'm worrying about going to doctor's office right now. Is that safe or not? Okay, that's a fair question, Mark. So let's address it. Our office has not been closed throughout the COVID-19, and there's few reasons. One, we are essential services. Two, the COVID-19 has not replaced diabetes, heart failure, COPD, breast cancer, shortness of breath, chest pain, infection in your toenail, or whatever is important for your health. So, the good news is there is telehealth visits. So Mark, if you're concerned about coming to doctor's offices, you can always do telehealth. Now, the other issue is, what's the prevalence of the new cases in our county? Luckily, in our county so far, we are not as prevalent, let's say, hotspots like New York. If you're in New York, I won't go near any healthcare facilities unless, of course, it's a medical emergency. But in a county like ours, the prevalence is lower. So, your chances of getting in a doctor's office, as long as everyone wearing a mask, the staff is wearing a mask, which we do in our office since, we have been doing it for a long time. In fact, if you don't have a mask, a lot of our patients, and thank you for shout out to all those patients who made the mask for us, and we can give one free one to anyone who does not have. Swing by our office and pick one. So in our office, everyone has to wear a mask. We have them wash their hands before they go back to see me or my nurse practitioners. We clean our office with the virucidal agent every time they sit somewhere. We took out a lot of spaces in the lobby. We not have typically more than 3-4 people and have the rest wait in the car. So if the doctor's offices or any surgery centers are doing those precautions, then, you got to live with the new normal. You can't suppress, let's say you have a mole and which is changing color. You can't suppress that. You don't want to die from melanoma just because you're worried about COVID-19. You should be worried, but just make sure the practice or the specialist you're going to, or the primary care you're going to, their office is wearing masks. They're using common sense precaution. Will it eliminate you getting it? No, nothing will eliminate. It's a pandemic. But, as I said, you don't want to die from uncontrolled diabetes, in this era as well. So you got to take care of your chronic conditions. You got to take care of vaccines. There is a lot of pediatric data that kids are having issues and in terms of not getting vaccinated for preventable ailments like polio, measles, MMR. Not good. Yes, you should be concerned, but you don't want your kid to have measles, which is still lurking around by not taking the vaccine. So yes, you should be concerned, but not if the places you're going take common sense precaution and you take common sense precautions too. So yeah, you got to be careful, but you got to live your life and you got to take care of your chronic health issues as well. Ray has a comment. Is it take out food safe? I know it's not healthy. All right, Ray. So the answer to that question is the data that the COVID-19 can come through food is very minimal. So in other words, the food contamination of COVID-19, the Mother Nature give us a very highly potent acid in our stomach, the hydrochloric acid, and which kills everything, So in terms of you getting it from food is very minimal. But, if you are interacting and talking to the delivery person, and delivery person is going to a lot of places, and they're not wearing masks, and you're not wearing masks, and you're not keeping 6 feet distance from the delivery person, can you get it from delivery person if you spend more than 15 minutes with a delivery person face to face? Sure. So that's something you got to be worried about. But in terms of the food giving you, the chances are very remote, as long as you're not interacting too long with the delivery person. So yes, you can get the food delivered to you. Please help the small restaurants, not the big chains, if you can. They are going through a very tough time. I have a couple of realtors, and they were telling me a lot of small businesses, even with the federal help, is not able to keep their doors open. So it's good to support small businesses. Now, how many of you doing breathing? Give me some comments so that way, I'm not wasting my energy on the breathing exercises. Are you guys doing the breathing exercises regularly? Put in the comment section. Yes, Dr. Mahajan, we are. So please keep doing it. Show me some love. Give me some comments. Give me some shares on that. Let me see if we're getting any comments here. All right, so share, like, and love right now, if you can. I'll appreciate. We work very hard every week to get you this good content, so we'll appreciate your love and like and shares with your friends and family. We've been in the practice for 25 plus years, and if you have anyone who's moved in new to the area, do refer it to us. And then think about us if you need to make an appointment. We are looking for new patients. Call our office, and we'll be more than happy to accommodate them. All right, so let's talk about the breathing exercise we have for today. The breathing exercise I selected for you guys today is called KapalaBhati. I gave a teaser yesterday, whosoever tuned in yesterday. We talked about it yesterday. Let me see if anyone else has a question before I move to the exercise segment. Ray Davis said yes, he's doing the exercises. Good job, Ray. Kelly Smith says yes, she's doing the exercises, breathing exercises. And Miss Fink said, here, let's put that up there. I do breathing exercises to get to sleep, and it works. Thank you for sharing that comment, Miss Fink. And, I do it myself, and I see it relaxes me because I see a lot of patients a day, and it's stressful going to the hospitals, going to nursing homes, coming to office. It calms me down, and I've been still going strong after doing it for 25 years. So the breathing exercise has helped me, relax and keep me centered. So mindfulness works, I can tell you from my own experience. So please try practicing it. So let's talk about KapalaBhati. KapalaBhati, or it's called Breath of Fire, is a fantastic breathing exercise, which is new to your toolkit unless you listened to it yesterday. If you have heard me, we talked about victory breath in the past. We talked about, the alternate nostril breathing. We talked about square breath. And then KapalaBhati is a newer kind of breath. So what does KapalaBhati means? The Kapal in Sanskrit means skull, and Bhati is illumination. So it makes your mind clear. It makes your skull get clear in terms of with these exercises. And it also clear up your sinuses. And it's a good exercise if you're doing meditating. And like Miss Fink was saying, she uses breathing exercise to go to sleep. So before she does the calmer breathing exercises, as I said many times, the exhalation, slow exhalation is what we control the parasympathetic system. It calms you down. This is more controlling your sympathetic system because we're doing a little bit faster breathing. So you want to do it first, the KapalaBhati, and then do the slower breathing like victory breath, which I taught you earlier. So KapalaBhati, if you put your hand on your finger, do it with me. And then, go 3-4 fingers below that, just in the middle of your belly button, and your pubic bone, that's the muscle we want to use to exhale out. A lot of us make this mistake of breathing through our neck, our shoulder, our chest, but not using the big muscles of the belly. The big muscles of the belly, they help you get you what we call the second heart into place, the diaphragm. So if you engage this core muscle, you will get a deeper breath. So what I want you to focus is just the exhalation. If you focus on the exhalation, you will inhale automatically. So this is how it works. So if you're still not sure where is the muscle, just put your hand in front of your mouth and cough. So you will see that muscle contract up there. That's the muscle we are after. So if you put your hand there just below your belly button and breathe out. Keep your lips closed and breathe out through your nose. Don't put any effort in breathing in. Just use that muscle and breathe out. Like that. And if you can do that for 20 minutes, 20 times, 20 minutes is too much. 20 times, a couple of times a day, and you will see the benefits. So, it sounds like this. Don't use your shoulder, don't use your neck muscle, just your belly button, below the belly button muscle. Let the air come back in. Inhalation should be automatic. Just focus on exhalation. So do it 20 times with me. If you can't do that fast, you can do slow. You can go up to 1 second if you can do exhalation, inhalation after 2-3 months. You can do 2 exhalation, inhalation in 1 second. A lot of people have difficulty getting there, but if you practice, you'll get there. So that's called KapalaBhati, and I hope you practice that regularly. As you can see that whatever I teach you is connecting the dots. It is helping with anxiety, it helps with the breathing capacity, it helps you with your respiratory immune system, and that's all relevant in COVID-19. This is not fluff. And research it. If you're not sure I'm telling you the right thing, but you can research it. We'd love to get your comments, and if you're watching us later on YouTube or Instagram or on Facebook Live, please do comment, and if you want me to cover any other topics, do mention that. If you love our show, please give us some love today, and so that way we can bring you. We got a few exciting guests lined up, so you can hear the guests as they bring them periodically. And with that, we're coming to the end of the show. Be nice to yourself. Be nice to your loved ones. Be nice to the biosphere, and keep the social distancing going. Ciao. We'll see you next Thursday at 4:30. And please give me love and share. Thank you.